I started recording this session. All right, great. Well, hello everyone, and welcome to today's live event titled Stakeholder Engagement in Community-Based Evaluation. This is hosted by Evaluation Capacity Network, located in Edmonton, Alberta. We are glad that you decided to join us for this event. First, let me introduce myself. I'm Sherry Rezvani, and I'm a researcher at the Center for Community-Based Research, and I will be the moderator for today's session. Just to let you know that this live event is an hour long, and for the first half, our presenters will speak about stakeholder engagement in community-based evaluation, and will share stories from the field. We will pause a couple of times to ask questions from you and engage you in the conversation to ask your perspective on the topic. So make sure you use the chat box to answer our questions, as well as sharing your own questions during the presentation. Rebecca, may you please go to the next slide? Thank you. All right, amazing. So you can find the chat box on the bottom bar on your screen. So make sure you send your answers and questions to all the attendees and panelists so everyone else can also see them. For the second half of the session, we will be answering your questions. So there are two ways that you can ask your questions. You can use the chat box, or you can use the raise hand feature. So it's very simple. You just click on raise hand on your screen, and then you will get unmuted to speak out and ask your question. And one of our presenters will stay longer after 1 hour to get through more questions. So feel free to stay longer after that hour if you wish. So just want to let you know that this session will be recorded and made available on our website, so you can access it later. And also a PDF version of the slide deck will be shared with you after the event. Well, I'm pleased to introduce today's presenters, Rebecca and Jean. I pass it to you over, Rebecca.
Great, thank you, Sherry, and welcome everybody. I can't virtually see you, but I know that there's lots of you that have joined us today, so welcome. So my name is Rebecca Gokert, and I'm a professor in the School of Public Health at the University of Alberta. And Sherry mentioned my organization, which is the Evaluation Capacity Network. I'll tell you a little bit more about that in a few minutes, but I'll let my colleague Jean introduce himself as well.
Hi, everyone, and thanks again for joining us. I'm also with the School of Public Health and with Catalyst Research and Development as co-principal and researcher with my co is Kate Woodman, that some of you will know. And I've been involved in facilitating or evaluating positive sustainable change for about 40 years, mostly in Alberta and BC, but across Canada and in sub-Saharan Africa. So, and I also should mention that I see there are some of my colleagues or former colleagues have joined as well. And I know that you have considerable experience in evaluation. And in the chat box, if you could also contribute your experience, that would be awesome. So a special hello to Dory and Zenobia and Marla and Dimitri today. Maybe I've missed some too. Hello to you too.
Thanks, Jean. So just a little bit about the organization that, or the network that I'm leading out of the University of Alberta. It's the Evaluation Capacity Network. And we are a national network primarily focused on supporting the social sector broadly, but more specifically, the field of early childhood development. We're going to introduce you to lots of websites today, so don't worry, the PDF will be available. So if you want to go check these out, because we have a number of projects going on, partners from across Canada, and different ways to engage us in both informal and formal learning opportunities.
Thanks. So at Catalyst, for about the last 10 years, we've been trying to customize evaluation, research, and capacity building, but also knowledge mobilization and conducting economic analysis. And this is to help our clients understand, improve, communicate the value of their innovations. But as mentioned earlier, I have this phrase, catalyzing positive change in programs, policies, and practices. So We focus on innovations in health and human services, primarily related to prevention and health promotion, but have worked a lot with early child development and young families, teen and youth health and development and mentoring, seniors, reversing effects of aging, violence against women, crime prevention, mental health and addictions, primary care networks, online learning, and refugees. And although, you know, the refugee issues tend to be not sort of so unique to refugees, although there are some unique, but the evaluation challenges can be similar to others. Our clients are NGOs and community and provincial agencies and groups, quite often collaboratives, intersectoral collaboratives. And we work with clients from 1 to 3 days for rapid consulting, to years if providing a start to finish type of developmental support. And I was going to mention that we have some limited capability, but can offer a free hour for projects like yours to help address a particular question or issue, problem. So if there are 5-ish people that call in as a result of the seminar, feel free to do that and I'll give you my best attention. So, and our emails are included as well in the presentation.
Thanks, Jean. So I just wanted to provide a little bit of context to the live event today. So this webinar is connected to a current national collaborative between the Evaluation Capacity Network and also the Center for Community-Based Research based out of Waterloo. And it's funded by IRCC, which many of you will be familiar with, and under the Service Delivery Improvement Program. And the focus is really on building capacity of groups that support refugee newcomers to do community-based evaluation. So last year, we hosted a number of practical how-to workshops across the country. And I think we sort of boarded a plane leaving Saskatchewan as the pandemic hit, made it back to Alberta. But this was attended by over 300 people. Maybe you were there and you got to meet some of us, maybe not. So, but we encourage you to check out our website because we've posted information in the form of webinars about those full day learning events. And what we really wanted to understand from our workshop participants, while they found it helpful, was what did they want to do a bit of a deeper dive on? So one of the topics, of course, was stakeholder engagement. We've hosted a few other live events on topics that were of interest to those that attended the full day workshops. And we encourage you to go check those out too on our website because they're posted there. So speaking of our website, we've got lots of resources up there. So we've got some videos about community-based evaluation for those of you that are new to that approach. We have an evaluation capacity readiness assessment. So individually you can fill that out or organizationally to kind of figure out where you're at with respect to your evaluation capacity. The Center for Community-Based Research does support organizations in ethics, especially if they're working in community contexts. And as I mentioned, we're not hosting any face-to-face workshops, unfortunately, right now, but we've got lots of webinars, and Jean mentioned mentorship and coaching. So we've got kind of mentors and coaches situated all across Canada. So if you're joining from a province, we probably have a coach or a mentor that's from that province that you can certainly go and connect with if you've got some evaluation questions or needs that you'd like addressed. And we also invite you to join, we have a community of practice, and that's through settlenet.org. So again, don't worry about writing all this down because you'll have access to the slides after. So I think Sherry kind of already gave us a rough breakdown of our agenda today. So for those of you that attended our full day workshops, you will be familiar with the community-based approach to evaluation. So this will be a little refresher. And for those of you that are joining us new today, you'll get to hear about that. We're going to be primarily focusing on stakeholder engagement, and Jean and I will share kind of our thoughts around that and a few cases from the field. But as Jean mentioned, we've got lots of friends and colleagues on the line today, and we recognize there's lots of expertise. So we encourage you to provide some of your examples or, what's worked, what hasn't in the past through the chat box. And we look forward to a lively discussion as much as we can make that happen in a virtual space once we're kind of finished wrapping up the presentation. So this is a picture of kind of the 4 phases of community-based evaluation. So it's kind of the GPS for doing community-based evaluation. So you'll see there in phase 1, it's really about laying the foundation, and it's based on the how to engage stakeholders in the process. So while stage 1 really focuses on identifying who those stakeholders are and engaging them in the process, we really need to be thinking about that across all phases. So we don't just identify, stop, and move on with our evaluation. We really need to think about how we're integrating that across the entire cycle of evaluation. So actually a lot of research on evaluation has shown that stakeholder engagement is one of the key indicators of evaluation use and influence. So when we get to the end of our evaluations. So by engaging stakeholders throughout the evaluation, we can plan the evaluation. So that's at stage 2, so that it aligns with participant, program, and policy contexts. We can open doors to optimize cooperation in data gathering and make it more appropriate to the context, and also get some support in making sense of the evidence that would be generated from an evaluation. So that's stage 3. And then ultimately, we can engage stakeholders in mobilizing the findings from the evaluation so that we're in a position to improve practices, programs, and policies, perhaps secure additional funding. So what's all this talk about stakeholders? For those of you that are working in the field, you're pretty familiar perhaps with that term. But essentially, a stakeholder is anyone that has a stake in the evaluation. So anyone that's directly involved in the evaluation, maybe through service delivery as a participant, or they might be critical to sharing the results as they hold a position of influence within an organization or even external to an organization that's offering a program. So we should really think about engaging stakeholders, and it's important because they can bring valuable information and perspectives to the evaluation context. They can add credibility to the evaluation. They may have resources to support evaluation. We know right now that resources are getting scarcer and scarcer. So, that could be human resources, expertise, time, energy, even financial resources. And they're often really critical to implementing or advocating for action based on the findings, whether that's just right within a program and making shifts to the program, and all the way to outside to scaling programs up or gaining additional funding for program kind of sustainability. And so also engaging stakeholders can really help when we want more people to build capacity around evaluation by engaging in it. And it also builds trust and understanding among program constituents. So there are lots of ways to think about stakeholder engagement. So here's a nice illustration from the International Association for Public Involvement, so IAP2, and you may be familiar with that from the community engagement context. They talk about stakeholder engagement across a continuum. So when we engage stakeholders, we can engage them on many different levels and for different purposes. So we don't always sort of engage people equally or equitably at all stages of the evaluation. So what that means is that we're not always going to engage them in the same ways. They could be consulted or just, we're pushing information out and sharing information with them kind of on that left-hand side of the continuum. So kind of minimal engagement, I would say, all the way to more deep engagement on the right-hand side of the spectrum, where they are collaboratively involved in, understanding what the issue is, identifying kind of the purpose for evaluation, perhaps even supporting recruitment and data collection and analysis, and ultimately sharing findings. So as I mentioned in the previous slide, when we engage stakeholders, we engage them on different levels and for different purposes. And there's a number of different strategies to decide on who stakeholders are, and even kind of identifying who those stakeholders are, mapping them for your planning and conducting the evaluation. And so in the next slides, I'm going to share some of those strategies, and then I'll hand it over to Jean to talk about finding some of the elusive stakeholders. So stakeholder mapping is a way to identify key stakeholders that should be considered in an evaluation. So this can be done in lots of ways. You can just, get out a whiteboard and start generating lists of stakeholders or anybody that might have a stake in the evaluation. Here's another way. So if you look on the right-hand side of your screen, we've got concentric circles, and really thinking about who are those people with lived experience, those that might benefit or the beneficiaries of a particular practice, program, or policy, or those that are participating in the program. We move out a level and we've got the influencers. So those could be the program providers. They can be both individuals, staff, all the way to organizations. And then ultimately the sustainers. So oftentimes these are the funders or the people in positions of power, decision-making that can help make the organization or program sustainable. And we also need to really think about some of those stakeholders that can be both, and I'm sure we all have experience with this, that can they can really facilitate evaluation, and they can also put up barriers around evaluation, or even offering, implementing programs and making shifts within a program too. So we need to be really cognizant of who those stakeholders are. We don't just include the folks and our allies in the map. We really need to think about everybody and their roles and responsibilities. And it's also really important for us to test our assumptions. So what do the stakeholders even think about evaluation, right? Some people have a very visceral reaction to it and they have negative experiences, and some people see it as a learning opportunity, as kind of an improvement orientation. So it's about really considering our own perceptions of evaluation, or people who are in charge of evaluation. It's our responsibility to determine who our allies may be, and also some of those folks that may be, putting up some blockades or barriers for us, and being really cognizant of that. And it's really important that we also think about who are some of those kind of stakeholders that are sitting in perhaps some of the darker corners. Doesn't need to be dark, but we need to shine a light, and we need to find those folks and bring them kind of into the fold. So as I mentioned, there's lots of different ways of doing this. So we can map it with concentric circles. I love working with groups and laying out the butcher block paper and getting out our stickies or our Sharpies and kind of writing people down and sort of doing a big group brainstorm. It's really critical that you involve as many people in that process too, so you don't sort of have your blinders on about who should and who shouldn't be involved. Here's just another example of thinking about folks that are internal or external, and then those that may be responsible for more operational short-term decisions, and those that have more of a long-term strategic decision-making role. You can also think about those that have perhaps different varying levels of interest and influence within an evaluation context too.
Thanks, Rebecca. Well, and as Rebecca mentioned, stakeholders are those that have an interest, and that interest is something that is really important to get to know. So it's important to know the nature of that interest, including the challenges and fears and risks that they might face. So what they have to lose as well as what they have to gain. In our practice, we found it really helpful to think about the less obvious stakeholders that might influence or be influenced by the innovation. This can be positive and negative. Again, for the next few minutes, please think about those in your situation, and note that come to mind as we go through some of the different lenses that might be used to look at stakeholders. And the next slide, please. Okay, so this slide didn't get animated, but it is, if you would just stick with me and look at them line by line. So MITROFF has 7 approaches to finding those stakeholders, and one is the imperative. So As you think about your project, are there people that feel so strongly that they would be ready to act positively or negatively in response to your project? You need to note those and find out how to connect with them and get their views too. There's a positional approach, so those formal policy and decision makers, and those are often easily found, and I encourage people and our clients to be bold in looking at whose policies and decisions influence the sustainability and potential for positive impact of your project. A reputational approach, sometimes when you speak with knowledgeable people, they'll say, you know, you should really talk to so-and-so, or you can ask that question, who else should I be talking with in order to get a full deep picture of the situation? So there are those, of course, who tend to participate already. And sometimes we segment those groups to make sure that we hear from them fairly. So when we're working in Zambia on impacts or influences on maternal death and childbirth, we'd be separating the young women from the old women, and the males certainly in another group, and the young males and the old males in their own groups. But it seems like those groups tend to back and forth influence one another and how they respond in a group context. Opinion leaders influence others. And so if there's somebody about to spread news to the positive or negative, find out who those people are. A demographic approach, so segmenting people according to different age groups, ethnicity, I mentioned gender already, background. Focal organizations, sometimes there are public organizations or even private businesses that have had important relationships with the groups that we've been working with in evaluation. So important to know those as well. Next slide, please. So some ways to involve stakeholders, certainly the evaluation participants, a team. We might have a group that's steering the whole project that might be the same as the evaluation, or there may be a few new people or people that drop off for the evaluation, but generally steering groups are wholly included in the evaluation as well. There might be an advisory team, which could be a large group. Sometimes we've had groups of 20 people in a kind of network that we put information out to get their advice on. And not all of these need to meet in the same room at the same time or in the same Zoom session. But think about it for your particular project and context, about different formulations of stakeholders that either get together or that you need to contact individually. Feedback sessions, certainly when there is data and we're looking for feedback on it, with tools as well. With data, we often ask for some assistance in some cases, and then certainly validation of the analysis. And then we ask stakeholders also to generate the implications and recommendations that they see coming from the data. And I think there's one more in that list. Yeah, implementing. So exactly what Rebecca was talking about earlier. So out of your evaluation, you'll have lots of recommendations for all kinds of groups and influencers, and who will be there to champion the implementation of those recommendations and to guide them and make them take root and really support positive, sustainable change. So in the question there, how have you engaged stakeholders and how is it changing in our new virtual reality? And you may have, and I see some are using now the chat area to to put questions in and to offer feedback. And this may be a good place to pause, is it, Rebecca, or one more slide?
Sure, we can pause there if people want to add some thoughts into kind of how they're engaging stakeholders. I see Marla also involved in developing recommendations, which is fantastic. So sometimes we find that there's certain stakeholders we want to engage in various committees, whether it's evaluation, advisory, or steering, and they will perhaps not be in a position to do that because of a perceived conflict of interest. So how do we engage folks that we know we need, those decision makers kind of sitting at the table, and maybe it's thinking about other kinds of strategies, right? I mean, in some of the projects we've worked in, we do partnership interviews, so kind of gathering information in that way and feeding it back where we can't actually have the individual. So it's a little more anonymized and confidential, but we can feed back that information back into the evaluation process. So online bulletin boards to get feedback. Yep, fantastic. Yeah, so definitely in our new virtual reality, we're recognizing some of the, who's got access to technology, because that's become critically important when we can't see people face to face. And so how do we actually need to equip some of the participants in our evaluation with the technology they need? So one, Shanice has shared that they had to get cell phones to their partners, even thinking if you're using arts-based approaches like photo voice, how do you get cameras in the hands of youth or adults that are participating in that way? So these are fantastic. Please keep adding. Yeah, keep adding ideas.
And the chat, I believe, is available as well at the end of the session.
Yeah.
I'm going to say just a bit more as these continue to come in. Please feel free to continue to add to the chat. But I wanted to specifically look at a stakeholder steering committee. And that's the next slide. First of all, at the purposes that this might serve. So as you look at your stakeholder steering committee for your project and for your evaluation, but and please do consider the need to ensure that the major interests are represented. That in that steering committee, you'll try to represent the collection of interests of the stakeholders, even though there may not be a representative from each and every stakeholder group. You may have a stakeholders committee, steering committee of 5 people, but somehow they'll have to bring in those interests and ensure they're represented. They'll provide guidance in the evaluation process and support as you go along, and then ensure that results are used for change. We found it very helpful to have a specific terms of reference for steering committees and evaluation, steering and advisory groups, so they know exactly what their purpose is. The membership is known, expectations are clear, and we share those with them and ask them to improve on them. So we discuss the terms of reference. So it's a good appropriate fit for the project and for the people that are involved. Membership, you can use your stakeholders map together with the terms of reference when selecting. And I know that the reality is that sometimes you don't have much choice, and some funding organizations or host organizations want to ensure they have this person, that person, but work with them to just ensure that the membership and the terms of reference, the purposes can be carried. It's worth working with them up front so that steering or advisory group can be just as helpful as possible, right to the ends, which are using the knowledge to create positive and sustainable change. There's lots that could be said about managing steering committees, but one I thought would be, important to mention, was meet regularly, but not too often, right from the start to the finish, planning to utilization. And in along with that, you'll find that some of the stakeholder representatives won't like to attend meetings, but they may be very, very interested in being in communication. So when we're involving physicians as a voice in early childhood development schemes at the community level, we want to be sure that their voices are heard, and yet they don't come to meetings. So we find other ways of contacting them directly or responding in print, etc. So something important to consider is the leadership from stakeholders. And you can go ahead, Rebecca.
Sure. Yeah, and I mean, there's fantastic, I'm sort of reading all of the discussion and the questions that are popping up, and unfortunately can't type and present at the same time. But I think, Jean, even you just alluded to that idea of, especially right now, many of our health oriented stakeholders that we would want involved in evaluations are completely overwhelmed and have no capacity to participate. And I think that's the same for many settlement organizations, and things are very much in kind of a responsive and reactive position. So, you know, even sort of saying right now, how do you even back off of some of the evaluative requirements, and what is sort of actually, you know, like what has to be done right now in terms of monitoring, and what are the ways to stick handle around that. And that's where having stakeholder kind of steering groups or advisory can they have their finger on the pulse of what's going on in the context, and maybe can give some really good suggestions. And I found recently in one of my projects where we just have to meet people whenever they can meet, and that typically is starting to be in the evening, you know, 6 to 8 p.m. when they can get online, or just a really quick phone call. And we're starting to use, you know, texting and WhatsApp and those kind of things, just to do really quick check-ins. And I know it's not ideal, but it's sort of the best we can do right now.
I was going to just mention something, thanks, Rebecca, just mention something briefly in response to Michelle's question there about stakeholders being overwhelmed by communications of all kinds and surveys, etc. I think this is really important to be aware of, and particularly during pandemic times, but in general as well. So we've dealt with this a bit through when we're mapping the stakeholders, we map their interests, we map the person that's responsive, that's a point person for communication, and also like the duration that person will be involved, but the way in which we ask them specifically how they would like to be contacted when we're orienting about the evaluation. How and when would you like to be involved? And sometimes what we start out thinking turns out to be different. You know, some turn out to want to be involved more and steadily through the process, but most would like to be involved just for punctuated short-term periods, like maybe once in the design, once in the generation of the tools, once in the formative, and once with the summative discussion that then leads to the knowledge dissemination. So over a 2-year project, they might only want to be involved 4 times. And that to me is really, really good, but it does get their voice in there. So for each particular type of stakeholder, you may have to tailor that communication.
Mm-hmm. Thanks, Jean. So keep the questions coming and the responses. I'm seeing lots of our friends online, so I appreciate that. And you've got lots of expertise too. So Jean and I wanted to share a couple case examples. I was looking for a Clint Eastwood Dirty Harry picture I could put here for the good, the bad, and the ugly, because we know in stakeholder engagement, and actually even in one particular engagement with a particular stakeholder, you can go across that spectrum of the good, the bad, and the ugly, and back to the good. So certainly stakeholder engagement is all about relationships. So it's, you know, what kind of relationships can you build with people? And sometimes we have to do those rapidly, you know, to have them engaged in the right ways. So I'm just going to share an example from the field, and some of you may be familiar with this example. I use it often in my teaching. And then Jean will share one from some work that they've done through Catalyst. So this particular example is kind of stakeholder engagement gone wrong. So it's about reducing rates of malaria. So the issue is that, you know, 500,000 people die of malaria each year in Africa. And so the research was conducted, and they identified that mosquito net use could be a magic bullet for malaria prevention. So fantastic, we've got a solution. So what we'll do is we will distribute mosquito nets widely, and everyone has access, and then, you know, people will use them appropriately, and we will have a reduction of malaria, right? So that's sort of the A plus B equals C. Well, that's not kind of how this particular situation turned out. So in this particular situation, you know, the scientists started looking at it. Well, malaria rates weren't going down. So why was this? Well, when they started digging a little deeper, they realized that food was a more immediate need for locals than preventing malaria. So that's what ends up happening certainly right now when we're in a COVID situation where we think we're offering a service. In fact, it might be just basic needs like food security that is the bigger immediate need. So it's being able to pivot and shift really quickly, but to understand that context and have those stakeholders that can let you know what the context is, so you're not sort of blindly guessing. So what ended up happening is the locals sewed their free nets together, and they used them as fishing nets instead, so they could deal with their food needs. And so also there was this issue around beliefs that, you know, things coming from European countries where the nets were being distributed may be introducing poisons through the nets. And they were concerned about this poison making them impotent. So there were kind of two things at play there. So they didn't want to use them as they were intended. Also, there was an unintended consequence of sewing the nets and starting to fish, which seems like a very reasonable response to a food need. There were fishermen that started to lose business, and it was also reducing the fish population. So there was kind of an ecological impact and consequence to what was happening here. So this is one of those situations where we can sit back and say, well, now how would have better stakeholder engagement, understanding the context, talking to the local people, co-creating perhaps the solution to what was going on, could have actually resulted in perhaps distributing mosquito nets and having those used in the appropriate way, but also recognizing that there was another issue at play. So I think, Jean, you also have some experience with this particular case that you might want to share.
One of the first projects we worked on in Zambia in Western Province straddles the Zambezi. Was very high rates of malaria, and this in some ways illustrates the importance of getting clear pictures from stakeholders, and maybe starts on an answer to Robert's question as well about stakeholder bias. But when asking our initial contact people, we were trying to get to the bottom of this problem of high malaria and rates. And the people we were earlier on connected with were people that were promoting gender equity as their primary vision and mission and goal. And they said it's because the men in the village take the nets and leave the women and children exposed. And so we took that as information and, you know, looked at that. But what we found out when we looked at sort of physically putting pins on a map that geographically showed where the high rates of malaria were, they were everywhere away from the highway. And what we learned was eventually was that the Ministry of Health district office ran out of a fuel budget right at the time that the container of malaria nets were dropped off at distribution points. and so could not take them back to anywhere, beyond just the few villages that bordered the highway. And when we looked at that, then we saw that the stakeholders that we'd originally talked with, although they were engaged with people in remote areas, they had particular bias in their view. And so they saw a lot of the problems of communities as being attributable to men and the gender inequity, power differential, etc. But also the district health office was reluctant to admit that they ran out of budget for fuel, which was it would be totally forgivable of them to do that. But because they didn't want to admit that inadequacy in their resource allocation and then be, somehow held accountable for that, they didn't say that up front. So yeah, just kind of keeping in mind that when you're getting to know your stakeholders, get to know all of them and get to know their interests, but also the fears and risks and challenges that they face in working with you, as well as their ability to facilitate the evaluation and the knowledge use. And then we could go to the next slide. Yeah, one example I was going to share was in this work that we do in violence relating to family violence, intimate partner, and gender-based violence. As many of you all know, November is Family Violence Month, so it seems appropriate to use this example. And this is a really widespread and important problem. Over 100,000 intimate partner violence victims per year. And that's only part of the picture of what we're looking at. And then another 100,000 child victims of family violence. And these are police reported. Many, many more that aren't reported. Response in Canada to this challenge is to set up emergency shelters. And then there are a few that have second stage or transition shelters. So emergency shelters accommodate women and their children, typically, normally, for 21 days. And then second stage transition shelters could be 1 to 2 years, but very few people can be accommodated there. Problem is that these are all overflowing. Well, in most urban areas, at least, many individuals and families are turned away, and there are very, very few, if any, shelters in many rural areas. So they have to respond differently, and the response then, the kinds of action that we studied was outreach work. So getting workers out into the community to meet with people outside of the shelters. And in Zambia, the work there is really focused on also on working with perpetrators, because in impoverished communities, people can't easily leave. And I know this is the case with many immigrant and refugee situations. And then on prevention as well. So upstream prevention to address determinants of violence, which in large part can be due to, we can work on education for girls and women as an example. So, and the next slide. So some examples from that work in family violence with particular emergency shelter, going into these innovations in outreach and working with perpetrators, etc. We had the steering committee, and just to put some numbers of the size of the groups that were involved there, steering of about 5 people, a staff team that was about 8 people, and then an advisory network of others that came in, other stakeholders that came in. Some were funders. There was a city administrator and a politician and a few other interested in that advisory network. In some combination, these 3 groups reviewed everything and helped to manage overall. The steering group was, of course, the most, had the closest eye on things. And all of these had an opportunity to review on 3 occasions. And then staff team individuals were integrated eventually in the advisory group. So, the difficulty of managing many different stakeholder group combinations is you just run out of time and energy. So, so look for opportunities to kind of put people with different interests together. Major activity was in creating an evaluation design or a framework, and there the steering and staff group brainstormed with us and then responded to the framework that we synthesized to optimize it. So we're trying to, again, manage their work down to a doable amount for them. And this is what worked out. In the area of developing data gathering tools to complement theirs, we had a sense of what was needed, so we developed specific tools, but they reviewed them and gave revisions to improve them. We did a gender-based analysis, or a GBA plus actually, which takes into account other determinants of well, formal determinants of health, but also determinants of violence. And they responded to that draft that we put out there and expanded and eventually validated it. And then the groups were, particularly the steering group, but also the advisory network was involved in the formal evaluation, formative evaluation, sorry. And that was about learning, improving, refining the questions we were asking in evaluation, generating implications and recommendations. And then the summative evaluation, again, we presented a draft of what the data seemed to present. They revised, validated, and then at the same time updated the knowledge utilization plan. How are we going to move this into change in practice program and policies? Finally, we did a social return on investment analysis. And again, the stakeholder group, and this time it was primarily the steering and head staff person were involved in the design of that, and then the utilization of that. So, you know, so the stakeholders were involved in different ways at different times, but collectively we tried to tailor it to their interests and ensure that their voices were involved at critical points, and then that we could work up with them to the point of knowledge, of them supporting the utilization of knowledge. So I think that's what I'd like to say there. And yeah, if there's any questions about any of those things, I think we're a little bit behind, so please just pop them in the chat box.
Jean, there's a couple questions really specific to your example. So one from Megan and Bridget. Do you want me to read them out, or
Sure.
Can you? Okay.
Yeah.
So Megan was wondering, are there any suggestions for how to measure violence in a way that won't endanger individuals? We were going to ask healthcare users if they had felt safe at home during the pandemic, during a patient experience phone survey in BC, but then remove the question after fears that individuals experiencing violence at home may be endangered. We then investigated the possibility of including a violence resource as part of the mail out, but then similarly decided that this may endanger individuals. Is there best practice for measuring violence?
I'm wondering if I should be looking over my shoulder to my co-principal, Kate. And what comes to mind is a tool that we've been using in our work in Zambia, actually, which is a quick screener, but then a more in-depth danger assessment tool. But I think what your question relates to is specifically about how to measure violence when there's risk of violence involved. And Kate, would you have a response to that? I'm pulling in my partner here.
Yes. First, I would want to know why you were asking the question, because if you're going to ask something like that, you need to have for that person that you can provide. Otherwise, you know, ethically, you're putting them at risk and you're not offering anything to help them if the answer is yes. So if you're going to ask the question, you need to have resources, a resource list and numbers for where the person can get help. if you're going to ask the question, don't frame it using the word violence. You could talk generally about their wellness, and then you could follow up with them individually if that seemed an appropriate thing to do. So those are some of the techniques that we would use. There are captures in Canada and globally of the increase in incidence and prevalence of violence against women directly related to the pandemic, and maybe that data would help you for the purpose. I mean, I don't know the purpose of your survey and how integral the question about violence is if you can't get at it through other questions on wellness and mental health. So I don't know, just off the top of my head.
Yeah, thanks, Kate.
Mhm.
And this might be an example, Megan, if you'd like to just follow up. You know, we could take a bit more time and understand your context, you know, rather than give a quick answer that might not be quite appropriate or effective. So do feel free to email me at the email provided. And if you'd like to, we could talk about this in more depth.
Mm-hmm. Jean, there was another question around the intention of integrating gender-based analysis. And so did that lead to kind of additional or different kinds of stakeholders that you would have engaged?
Mm-hmm. Yes, it did. Yeah. And I think that when you broaden the view from family, intimate partner, gender-based violence, to include the context that people live in, the economic and social factors that are very, very important, critical to their context, and take into account those fears and risks that they develop. Yes, that gender-based analysis was very helpful, we thought, in bringing perhaps better questions to light and you know, offering new questions to explore.
Great. And it looks like Maria's provided some feedback too to Megan, which is lovely. Do others have questions for me or Jean, or even any of our other folks on the line? Because we've got lots of ideas too around integrating technology, because we're all in this virtual context right now. So new applications, and I think, you know, those are wonderful, but we also have to consider, you know, who are our participants and do they have the capacity around technology or even access. I was on a call just before this where we were using a new program called Mural, not Mural, there's two different ones. And, you know, rapidly people had to sort of figure out how to work the technology in order to move stickies around. And so, you know, it becomes really challenging making assumptions about people's ability to respond in certain ways. And I know certainly, you know, we even question that even around surveys, right? People's literacy levels, and, you know, is that a comfortable way even to share their information? So other questions?
And I think were we going to just respond a bit further to Robert's question yet?
Oh, sure. Yeah. And I'll move to that.
Robert asked earlier. Yeah.
Yeah.
So how can an evaluator ascertain that the stakeholder is done? Sorry, I just have to move a piece here so I can read it. That the statements of a stakeholder are a reflection of reality rather than calculated to influence the evaluation project's analysis and recommendations in the direction desired by the stakeholder. Well, I gave a couple of examples in that illustration about the malaria in Western Zambia, the malarial causes and remedies. But in general, this is the constant challenge for many kinds of issues, especially where people with diverse interests are not used to meeting together and contributing their thoughts. So several methodological ideas that come to mind, and Rebecca might have more. You know, again, refer to the importance of understanding and mapping your stakeholders and their interests, the challenges and fears and risks that they face if they risk losing funding because your recommendations are saying that something other than their then their nature of their work is needed, which is often the case. Have to chart that and know about it and then work with it. Of course, this is quite clear in the FGM, female genital mutilation movement. Those who profit by it you have to find them another way to make profit, to make income. And when you do that, I said you have to find them, but they need to find another way. You can be help with that. But until that happens, there's often difficulty in controlling FGM because there's a financial interest involved. So know those interests, challenges, fears, risks, and develop risk mitigation strategies. A second idea is about triangulating data. We use multi-methods, typically qualitative and quantitative, and different ways of gathering data. So some may be in an interview, but some may also be in a focus group where those interests, where those statements might be called into question. Certainly, people are entitled to their opinion, and you'll have false reporting happening under all kinds of circumstances, qualitative and quantitative. So that triangulation of data, and then showing that, this may be, there may be this bit of data that is saying this, but then this other batch of data is saying quite the opposite. So when presented with that equivocal kind of data, the steering committee and the advisory, or whatever combination of stakeholders group that you're using to steer your evaluation and to throw light on the analysis, to help in analysis and look at what knowledge is coming out of there. They will help you and stand by you, I guess, in a sense, if you feel that there may be some biases introduced. But certainly, I tend to look at the steering committee for direction on things like that, like when data really pokes out as being odd or unusual, and looking for the reasons why that data might be what it is. Involving a steering committee can be very much helpful in capacity building for them. Not only for this particular project, but for any projects that they're involved with in the future. Mm-hmm. But Rebecca, you may have other ideas.
Sure. I'll just add a couple points, and I see, and my colleague Dory has provided some suggestions there too, that we should always assume that people have biases, right? And I mean, that's a good thing, that people come with different lenses and perspectives. I always sort of come at evaluation with sort of this being a knowledgeable and naive at the same time, kind of playing that role of asking those, questions that other people can't ask in a particular context, right? Asking the dumb question, right? Like, oh, it doesn't make sense that this is like this. The other piece is around finding other ways, and I'd mentioned this earlier. I find doing one-on-one interviews and then actually collating that information and bringing it back to a steering committee. So oftentimes you may sit around those tables and a voice is saying something and that voice is not being heard. And sometimes presenting data back to a group, in a way it's kind of disconnected from an individual or an organizational perspective. And you can say, and here's what we heard when we looked at all that information. People go, wow, why aren't we paying attention to the times in which we're offering this program to participants? And the one person sitting in the back going, I've been saying that at every meeting for the last 5 meetings. So really kind of that role of the evaluator as kind of a facilitator and a mediator, and thinking about kind of sneaky and strategic ways. Sometimes you have to be sneaky, but putting information in front of people and getting them to react to it. But, Jean, I like your point about always triangulating information and not taking it out of just one source or another, but really looking at, where does the information diverge and where does it also converge and make sense. I am aware that we're at our time, and I actually need to head off to another meeting, but I know, Jean, you had agreed to stay on and support some additional questions that folks might have. I think we wanted to move to a few more slides just to wrap up. Again, Sherry has access to all your contact information, so she'll send the slide deck so you've got access to Jean's contact info, my contact info, and also CCBR. But I wanted to thank everybody for joining today. I wish I could see you all. I love meeting people face to face, but this will have to do for the next several months.
Thank you, Rebecca and Jean, for the great presentation. I enjoyed it a lot, and I hope you all enjoyed it as well. So before we conclude the webinar, I would like to let you know that this conversation is not over. So we have a place that Rebecca mentioned before too. It's on settlenet.org. It's an open group called Equipping for Community-Based Evaluation. So feel free to join that group. There are other people who are interested in the evaluation you can have discussions with. And don't forget to register for our next live event on December 11th, Life Beyond Refuge Stories of Impact. And you can also check out our previous live events and also webinars and many other great resources and information on our website. And Rebecca also mentioned that we have customized support. We can check out the list of our mentors across the country if you need support for your evaluation. And we also offer coaching sessions and training across the country. We have great sources on our website, so make sure that you check them out. And for those who are interested, please stay with us after this 1 hour, and Jean will answer more of the questions. Thank you, everybody.
And I'll be on for a few minutes in case